Hello, hi. Your favorite online therapist is here. I'm PT Omodibo Elizabeth, and today It's quite a while. I'm back. Yes, I'm back. And today I'll be talking to you about multiple sclerosis. And multiple sclerosis, I don't know if you have heard it before because it's not so common in this our environment. And for those that have heard it before, what is multiple sclerosis? How can it be managed? How can we not, how, if we know anybody that has it, what do we need to do to help them to live as independently as possible? That's what we want to talk about today. So it's good to have you back on my YouTube channel. Before I start to discuss with you about multiple sclerosis, I want to do me a favor, and that favor is to subscribe to this channel. It's very, very important. If you subscribe to my channel, it will help my page to grow, my channel to grow, and at the end of the day, I'll be able to give you more important information on different health conditions that can be managed by physiotherapy. Now, back to multiple sclerosis. What is multiple sclerosis? Multiple sclerosis is a chronic, typically progressive disease involving the damage to the myelin sheath of the nerve cells in the brain and spinal cord. That is big English, isn't it? Okay, simply put, multiple sclerosis is damage to the nerve in the brain and spinal cord. Why do we call it progressive? Because when you have multiple sclerosis, the generation, starts gradually, and before you know what's happening, the individual will not be able to walk and be able to do things they were doing before, and that is where physiotherapy comes in. But first, what are the symptoms of multiple sclerosis? Since it involves brain and spinal cord, the individual will start having blood visions, the individuals will start having swallowing issues, the individual will start having speech impairment, and also inability to walk, uncoordination of gaits. At the same time, the individual will start having weakness of both upper limbs and lower limbs. Sorry, I'll have to use that one. Weakness of both hand and leg. Individual will not be able to walk independently, or they will need an aid to walk. And also, it will also affect sexual dysfunction. Individual will start having sexual dysfunction, bladder problems. All these are all encompassing in the symptoms of multiple sclerosis. But what is the cause of multiple sclerosis? Multiple sclerosis does not have a particular cause. It is idiopathic in nature, and there is no particular cause. Most of the causes that you may have may be environmental or genetic, so there is no particular cause. It's an autoimmune disorder, and because it does not have a particular cause, it does not have a cure, so it can only be managed. So what are the risk factors of multiple sclerosis? There are a wide range of risk factors. For those that are between the 20 years and 40 years, individuals of 20-40 years can have multiple sclerosis. Female are more prone to having multiple sclerosis, and also lack of vitamin D can result in multiple sclerosis. That's why we have it more in temperate regions. That's why white people have multiple sclerosis more, because there is no sunlight that can give them vitamin D that will help in preventing such cases of multiple sclerosis. There are also some viral infection that can lead to multiple sclerosis, like Epstein-Barr viral infection. That can also lead to multiple sclerosis. And also, we also have family history, genetic factor. If you have a family that has, in the family there is an history of multiple sclerosis, you have a parent that suffered multiple sclerosis, or you have a brother or sister that has multiple sclerosis, there is every likelihood that you might also have multiple sclerosis. So these are the risk factors of multiple sclerosis. So if you have all these risk factors, you need to be as careful as possible. And also, people in the temperate region, in the North America, Europe, they are more likely to have it, less likely to have it in Africa. But if you have it in Africa, it is possible to have it, but the percentage is also low. Now, how do you diagnose multiple sclerosis? If you start having all these symptoms that I talked to you about, blood vision, dizziness, impairment of speech, cognitive impairments, inability to walk properly, use your both hands and legs properly, numbness, tingling sensation, all of them come together, and you do not have any underlying disease that you think can cause this, what do you need to do? You need to go and see your doctor. See your doctor, and your doctor, after proper assessment, we might need to refer you for magnetic resonance imaging test that we call MRI. MRI will bring it out whether you have multiple sclerosis or not. So if it is diagnosed that you have multiple sclerosis, the physician will refer you to see a neurologist who will also do some other assessment too, to be able to narrow it down. For MRI, I've already bring it out that you have multiple sclerosis. So we also need to be on certain medication that will delay the progression of the disease, and at the same time you also be referred to see a physiotherapy. As soon as you have a multiple sclerosis, you need to have a physiotherapist. You need to have a physiotherapist with you that will always help you, because you're going to be on physiotherapy management for the rest of your life, because this will also help you to be able to live as independent as possible as one is managing multiple sclerosis. Now, what will physiotherapy do for you? It depends on the presentation. For those that have multiple sclerosis, there are stages of affectation. For you that maybe you have multiple sclerosis, you can still work, but not as independent as possible. Walking aid can be prescribed that will help you to be independent as possible, to be able to do things around the house on your own. And for those that cannot walk again, they will need a wheelchair, functional wheelchair, that will be able to help them to move around. All these are what physiotherapists will assess and help you to do. Then if you have coordination issues, physiotherapists will help you with what we call Frankel exercise and other exercises that can help you to be as independent as possible. What about fatigue? But the feedback exercises will help you. Breathing exercises and other things are things that physiotherapists will prescribe for you to be able for you to be as independent and as close to living as possible. So you now see that you need physiotherapy in your life if you have multiple sclerosis. So if you have a family member or you have multiple sclerosis, it's not the end of the world. It is not the end of the world. All you need to do is to look for a physiotherapy center around you, or get in contact with physiotherapists around you, and they will help you to be able to live happily and as independent as possible. Thank you so much for listening to me. I'm sure you must have gained one or two things from my presentation today. See you next time. And before I go, please, I have a page on Instagram. It's at wellhe21. I also have a page on Facebook at wellhe21. Please, I want to go and follow my Instagram page. We have a lot of wide varieties of devices that can help you if you have any issue, pain, musculoskeletal pain, spasms, spasticity, whatever issue you have, spleens, we have a wide variety of them on that page. You can order for yours and also contact us. We have a WhatsApp page there too. You can contact us. We will be expecting your order. Thank you so much. See you next time. Bye.